my channel, guys. So if you're new here, over here we do lifestyle, we do travel vlogs, we do almost everything, and we have started doing nursing videos, right? So I hope you enjoy this channel, and I just want to apologize to my loyal subscribers. I apologize because last week I wasn't able to post any videos because I wasn't feeling well, and I did make a post in the community tab. But anyways, let's go right into the video. I don't want this to be too long, okay? So today we're going to talk about the Maslow hierarchy of needs, and we're going to focus on the nurse Maslow hierarchy of needs. So for Maslow, we have the physiologic needs and we have the psychological needs, right? Or the psychosocial needs, right? But most of the times we use the physiologic. So I made up an acronym like when I was doing the nursing process to just cement it. So what I use is 1ASP, right? So when I meet my patient, most of the times I try to find out what is the main issue that is affecting this patient. Is it a breathing problem? Is it something that has to do with the blood and the circulation? You need to find what is wrong based on the diagnosis of the patient and when you go to assess your patient, right? So being at the top would be oxygen that supersedes all other needs. So if your patient is not maintaining saturation, oxygen saturation, and the normal is 95 to 100, if it's below that, you know that oxygen is the main need, and that comes at the top. The next need that we would focus on in the Maslow hierarchy of needs in the Jamaican context is nutrition. So if you know that you have a patient that is like iron deficient, and those patients, you know that nutritionally they are lacking something, or their labs are abnormal based on some vitamins and minerals, etc., then you would say, okay, nutrition is the need. And the next one is elimination. So you know that you can have patients that are retaining fluids, especially the persons that are coming from the operating theater. You know that sometimes you really have to monitor their output to ensure that it is within a normal range, so more than 30 mils per hour. And if there's an impairment in that, you know that you have an elimination need. So just pay attention to the fluid balance when it comes on to elimination. Pay attention to the what should I say now, the stool, because some persons are constipated, so that is also an elimination need. So basically you just have to reason out most of the needs based on the person's diagnosis. So it's really, once you get the hang of it, you understand, because most of the issues that we have in the clinical area is finding what the main need is, or finding the right diagnosis. So once you can find the need, you can definitely find the diagnosis, and that is why I came up with this acronym. So after elimination, you have your rest, activity, and comfort. It's not R, but I put the A, which is the middle of that whole phrase, right? Sometimes I forget the order in which it comes. So try to remember it's rest, activity, and comfort. Or rest, comfort, and activity. One of them. But I always get it mixed up. But you know what I'm talking about. But anyways, so for that one, you know, it can relate to pain, or the person having abnormal sleeping pattern and things like that. That's not an underhandle, by the way. I'm not sure about that one. Don't quote me on it. Google it if you need to. But you know, those persons that aren't able to function as they normally do, they have some discomfort. So you know that's rest, activity, and comfort, and or rest, comfort, and activity, right? So after that need, then you have your S and S. So I put 1AS. So S and S, but it's one. The S and S is one. So it is safety and security. Safety and security has to do with those patients that, you know, they're elderly, they could fall out of the bed, they're visually impaired, so therefore, you know, they can be exposed to different hazards. They might be reaching for something and they, you know, those fall hazards, and basically sometimes high blood pressure issues, those persons could actually fall into that category of, you know, safety and security. So those persons, you like pull up the bed rails. Those are most of the common interventions. You pull up the bed rails, nurse the patient near to the beds, nurse the patient near to the nurse's station, and things like that. And those are all of your physiologic needs. So your 1As are all of your physiologic needs. For the psychosocial now, you don't usually use those, but it's like, let me give you an example of a diagnosis that can be used in psychosocial or psychological needs, like deficient knowledge or ineffective health maintenance, related to deficient knowledge as evidenced by patient not able to follow the correct what would you say now, correct management of condition. It could be diabetes, it could be hypertension, depending what the situation is. So those would fall under your psychological need, because it depends on the patient's mind, what their education level, what they can understand, and things like that. So guys, this is how I remember the needs based on Maslow, the nurse's way, the Jamaican way. I don't know if any other country practices it like this, but I hope you did learn something from this video. Thank you so much for tuning into my channel today, and thank you so much for watching. Ensure to subscribe to my channel, please, and thank you. Like, we're growing little by little. I realize that every single day when I look at my channel, at least one somebody watch a video, and I'm grateful for that. Just please keep on sharing the videos, keep on sharing them with your friends. And if you're a nursing student that's struggling, just send them my videos. I'm gonna have more videos coming about how I remember certain topics, or sometimes I could even like talk about a specific topic that I was bothered with in nursing school. And I'm sure a lot of persons will benefit, because this was one of them. Maslow, it was really hard for me. It was really hard for me to get Maslow, and it was really hard for me to write nursing care plans as well, because most of the times I couldn't figure out what the need was. So as long as you understand Maslow, sis, you will get how to write your care plans. And probably one of these days I can, you know, go through care plan writing. I'm not the best at it, but as I said, I get the stem. This is the stem, and the writing the actual care plan is fleshing it out, and blooming is when you actually do the do, right? So thank you so much for watching. Another thing, I was gonna say something. Yes, I do have tutoring sessions based on my schedule. I always post the flyer on Instagram. I sent it to some of my colleagues. They are sending it around. So if you need tutoring for whatever reason, I do specific courses. So what you can do is like shoot me a DM on Instagram or Facebook, wherever. My name is It's Brittany. It's my real name on Facebook. So basically you can just send me a DM or text me anywhere you see me, or ask me in person wherever you see me, about the courses that I offer, my little tutoring sessions that I offer, and I will let you know. Most of the sessions will be 4 hours. I can do groups, I can do and basically any way you want to do it. If you want to do 2 hours, that's fine, but everything is on the flyer, and I can post the flyer from time to time. So if you follow me on social media, you will see the poster. So that is it for this video. Thank you so much for tuning in. Bye.